As Program Director, I want to welcome you to the website for the Lewis and Fraad Department of Pediatrics.
Residents really get to have their own patients here. When they start at the beginning as interns, they're given a whole panel of newborns, and then those patients are truly their patients for the next 3 years.
This is a place where they will learn how to be a doctor. They will not learn how to take orders. They will not learn how to follow somebody else's plan. They will learn how to be a physician.
Every patient that walks into the door is a patient for you. You get to run the service, you get to see the patients while still being precepted and supervised by attending physicians.
Having so much autonomy on the floors with the appropriate amount of supervision, I feel like has trained me and has guided me into becoming hopefully a well-rounded and competent physician.
They really guide us in terms of how we manage patients, in terms of giving us support and also encouraging a sense of independence.
They're kind of on the front lines actually doing the medicine and treating the patients themselves and coming up with a diagnosis and seeing the disease as it progresses from the time of diagnosis until discharge or until they can follow up with them in the clinic.
I understand how to think like a good pediatrician, and I have these wonderful role models that make me think.
Jacobi, unlike a lot of places, actually cares about your opinion, cares about your thought process, and also cares about how do you want to manage the patient.
Residents often come to me and they'll tell me, oh, I've never done this procedure before, but I'll say, that's okay, that's why I'm here. I'm here to help you with that.
That one-to-one interaction and teaching with attendings is something that I really looked for.
Our Resident as Teacher program emphasizes several things. First of all, it develops residents' awareness of themselves as teachers, which is really important. It gives them the skills to effectively and efficiently teach, and these are skills that the interns will then use as they progress through their residency training. They'll use as attendings, they'll use with their own patients and their families.
People that come here for residency, they get more than just training in general pediatrics. I think they also develop a sense of devotion and service to the population that they are working with.
The diversity of the population that we serve just made Jacobi very attractive. It just ticked all the boxes.
We're fortunate that we, our residents and us as faculty, get to see a lot of different diseases and illnesses, so we're constantly learning, we're constantly making ourselves better, and we're doing it for two reasons. We're doing it so that we can be on top in terms of training our trainees and also provide exceptional care. We're really part of the community, and I think the residents really feel that.
If you have the capacity for happiness, you will be happy at Jacobi.